My next guest, Tamarin, is married and has 4 children, works 11 hours a day as a social worker. Now, Tamarin says having a drink or 2 or 3 after work calms her down. But based on family history, she does wonder if she could be headed for trouble. Take a look.
I've suffered with anxiety my whole life. 10 years ago, I discovered that if I drink, I calm down. I'll have anywhere from 1 to 3. Sometimes after everyone goes to bed, I'll go downstairs and have a drink. During my childhood, my dad was always drinking. I don't think I ever knew him sober. Eventually, he got liver failure from it. I remember the last time I talked to him, I knew that was gonna be the last time I ever heard his voice. I never thought drinking would be a part of my life. I lost my dad. His brother died from drinking. It was a family legacy I didn't want to continue. My anxiety is my drive to drink.
Well, Tamarin is joining me along with our very good friend from Pfizer, Dr. Freda Lewis-Hall. So welcome to both of you. Thank you for being here. So, Tamarin, what is your greatest concern about having several drinks a day, or are you concerned?
I am concerned. I want to set a good example for my children, so I hide my drinking from them. But also, since my dad and his brother were alcoholics, I worry that I could have inherited that disease.
First, I want to congratulate you for acknowledging that there could be something here that needs to be addressed. So, Dr. Freda, let's start with the basics. Many adults enjoy alcoholic beverages, but what are some of the dangers?
So, alcohol affects pretty much every organ in the body. It can cause impaired judgment, it interferes with coordination, it can delay your reaction time, and it can affect your mood. And then over time, excessive use of alcohol can increase your risk for a whole slew of very serious health conditions: stroke, heart disease, liver disease, certain cancers, anxiety, depression, birth defects, and that's just to name a few.
Yeah, now, you mentioned excess alcohol use, so let's define what you mean by excess. How much is too much?
Health experts really vary in their response to this question. So some studies suggest that some alcohol might be beneficial to your health. Some studies suggest that there is no safe amount of alcohol. According to US guidelines, moderate alcohol consumption is 1 drink or less per day for women, 2 drinks or less per day for men.
Mm-hmm. So why are there different opinions about whether it's okay, not okay, good, bad?
It's complicated in part by the fact that from person to person, the effect of alcohol is different. Your sex, your age, your body weight, whether or not you've eaten a meal before you drank the alcohol, and many, many other factors affect how alcohol affects you.
Mm-hmm. Now, Tamarin mentioned that she's concerned with her drinking given her family history. So let's talk about the genetic aspect of this, how inheritable this is.
Studies show that alcohol use disorder runs in families, and children of alcoholics are approximately 3 to 4 times more likely to become alcoholics. So it's not just family history, it's social, psychological, and environmental factors as well.
So do you think that you have a problem with drinking, that it's interfering?
I don't think I'm an alcoholic because I don't need to drink, but I do use it to help with my stress and panic attacks.
Doctor, how do you advise people as to measuring whether they have a problem with alcohol?
Well, there are a few questions you can ask yourself for starters. So ask yourself, in the past year, have you had times where you drank more or longer than you had intended to, even though it may have caused problems at work, in your relationships, or in other parts of your life? Have you had times when you were craving or urging to drink? Also, have you had the desire to cut down, to stop, or even tried to stop but couldn't? have you found that you need to drink more to get the desired effect? And if some of these apply to you, go to your doctor and ask them to see if you have a dependence on alcohol and how to treat it.
As you say, there's nothing wrong with having drinks in moderation. It's when it starts to interfere with the pursuit of your goals. And think about it if you're at home, particularly if it's in your family tree, because it's certainly in my family tree, and so it's something that you do want to think about. If you or a loved one is wondering how drinking may affect your health or any health-related issue, then be sure to go to the website gethealthystayhealthy.com. You'll find resources there. You'll find loads of information there. It's right at your fingertips. It is a great website with lots of information.
Yeah, thank you. And of course, while you're there, you can sign up for our newsletter.
Yeah. Look, I want to thank all of my guests today, and a special thanks to Dr. Freda Lewis-Hall.